Whatever it needs, whatever it costs, we stand behind our NHS.
The NHS has saved my life, no question. It's hard to find words to express my debt.
You are the front line in this war against this virus, and we all pay tribute to you.
Pay tribute, but not prepared to pay more than 1%. There's anger right across the NHS today, especially among families who've lost relatives on the front line. Amita Ruplal worked on a respiratory ward in Birmingham. She died in January. Her sister, who also works for the NHS, says the government must do more.
Amita paid the ultimate price, which was her life. And I think it's a real insult because the nurses that are working there now are putting themselves at risk. And I just feel like it's rubbing salt in the wound, really.
Good afternoon, Health Secretary. There are still 12,000 people being treated for COVID in hospital. How hard did you fight for a more generous pay offer for those who are looking after them? And how hard are you prepared to continue to fight for those NHS workers?
Well, Libby, as you know, I am a huge admirer of all those who've worked in the NHS during this pandemic and done so much. And I'm very pleased that the NHS staff have been carved out of the pay freeze. We do have issues of the affordability because of the consequences of the pandemic on the public finances.
The cost of the 1% pay rise is estimated to be £500 million. It's a fraction of the £400 billion pledged so far in response to the COVID pandemic, of which £37 billion is being spent on test and trace and more than £50 billion on the furlough scheme. The Royal College of Nursing has set up a strike fund with this hard-hitting poster. But it's not just NHS staff who say the government's misjudged the mood. Tory MPs, including one former minister, are worried too.
This is economically illiterate as a policy because it's going to push staff who need to be rewarded at a time when they've been working really hard away from the NHS. And we need to have a very quick rethink because both on a moral and an economic level, the NHS needs to be supported at this time and the staff need to receive a proper pay settlement and pay increase.
This nursing union official says many are prepared to swap the front line for the picket line.
Anger leads to passion and passion leads to action. And I feel like there is going to be a lot of action in the weeks to come.
Whether or not that gives ministers pause for thought remains to be seen.